Many research groups have found that you can effectively use AI to predict health outcomes even with minimal information. And yes, insurance companies are already using AI for insurance coverage decisions, and there's really no laws protecting you, and we'll talk about it. Also, you should be very concerned about wearables now. A Stanford group found that you could use ECGs, electrocardiogram data, to predict patient mortality over a year, even ones that actual doctors found nothing wrong in. Turns out, if you train AI on information, even things that seem innocuous, they can make pretty accurate predictions. Another research group found that they could predict patient outcomes, how long they would need palliative care, just with their medical data. That includes things like their demographic. Used AI to determine how long a patient is going to make it. And one that I found most distressing, just using somebody's facial characteristics to determine if they are likely to survive cancer. Yeah, you can look at just the way that somebody's face looks, a model that was designed to determine how old somebody is, and apply it to outcomes for treatment. Now, in theory, these kinds of tools could be used alongside medicine to determine if somebody is a high risk, meaning should they get more aggressive treatment earlier on, but that's not how this is going to be used. You can already bet that insurance companies want to use this kind of tech to determine how big a risk somebody is. Now, technically, we are still protected by HIPAA, mostly, so our medical information can't be shared without our consent. But it gets a little sketchy when insurance companies are involved because you do report your medical information to them. What we aren't protected from is our biometric data. So there's companies like Garmin, other ones that you collect biometric data, and there was the risk that, say, that company sold your data off, not a lot of protection. It's not technically medical data, and we saw what happened with 23andMe with the selling of genetic data. Government programs to track biometric data are not a good idea. This is not benevolent. Now, tracking biometric data could, in theory, be helpful. Do you have a fast heart rate? Something that may not be caught in a doctor's office because maybe you have anxiety and your heart rate is always fast in a doctor's office. Or catching, for example, somebody's blood pressure over time so you can see changes. Those are things that you can do to track your health and you probably should be doing. The question is, do we need the government tracking our health data? Because I would say no. There's a lot of really interesting ethical concerns here, some of which are more disturbing than others. We've already seen employers wanting to put biometric scanners and EEGs on their employees to determine if they're tired, for example. If you are likely to not live for 10 years, could you be denied a job? Because that's actually a possibility now. If you find out that you're at a high risk for not surviving another 10 years, should you have the right to say that you don't want to know? We're entering a very scary age, and I'm not wild about it. Yeah, we're entering a technological dystopia. You guys along for the ride with me?